And now, just to Dr. Bar-Yam, it's really we're really grateful that Dr. Bar-Yam has spared some time to talk to us. He's a leader within the World Health Network, and I've actually posted a link to the World Health Network in the chat. Okay, he advised policymakers on the Western Ebola virus epidemic. He founded endcoronavirus.org, a global network of over 4,000 volunteers, is the founding president of England Complex System Institute, an independent research institution that studies complex system science. So really, you know, thinking about systems and system thinkers, really that's such a powerful way to think about the whole pandemic. And having sat through the global summit organized through the World Health Network, has given us a completely new lens on the international approach to managing the pandemic. So it gives me great to hand you over to Dr. Bar-Yam. Thank you, Dr. Bar-Yam.
So I actually want to start by answering the question that was just posed about data about schools and about schools and transmission and about workplaces and transmission. So let's think a bit through for a moment. There are some studies that have shown or said that about 40% of transmission happens in schools. So the way you know that is you shut down schools. It's a little bit different, right? You shut down schools and you find out that 40% of transmission goes away. Now, is that in schools, or is it on the way to school, or is it because people are going to school, they interact with each other? All of those questions you might ask. But let's just take for a moment the idea, which is not unreasonable, that when people are in schools with high density indoor presence, we don't have to guess that there's going to be a lot of transmission. But let's think about what the implications of that are. So let's say it's 40%. So the difference between having the transmission in schools and not having the transmission in schools is 40%. Now, would we see 40% more infections in schools than in the community? But let's think about how it works, right? People go to schools and then they go home. So let's say the rest of the transmission is at home or in workplaces or in other places. So you end up with 40% more transmission. And then one cycle later of transmission, you have 140% of cases. That happens in about a week, maybe a little bit less. And then the next week, you have again 140% more transmission. So how much more transmission do you have at that point? 1.4 times 1.4. You can do the calculation. It's over 100% more, not 40% more, not over 100% more. Let's just do the calculation, right? 1.4 times 1.4. I'm on the wrong. Is basically 100% more, right? So if you multiply that again by 1.4, what do you get? You get 2.7, which is 170% more transmission. So where is that transmission happening now that you have 170% more? And the answer is it's not just happening in the schools, it's happening in the community. And in fact, if you wait a few more cycles, it's very clear that all of the transmission that you're having can be related to the transmission that's happening in schools, because every sequence of transmission events includes a transmission event that happened in schools. And let's say in workplaces, the transmission is, 20% or 10%. It's still true that several transmission events later, most of the transmission or all the transmission, again, cutting out large meetings is another source of about 40% of transmission. And many of those are work-related meetings. So we think about work-related meetings as well as, workplace, offices and factories and healthcare locations and so on. So if the other places that are workplaces, in addition to schools as workplaces or as places where people go to school, they're also responsible for all of the transmission. So we have to think about the dynamics of what's going on, not just the kind of static measures of the number of cases that are happening. I hope that's helpful as a starting point for thinking about this issue of dynamics and exponential growth, multiplicative processes, and so on. I had in mind to talk about a couple of different things. I also had very early in the pandemic the experience of helping my wife, who also, fortunately for me, prepared my lunch that some of you saw me eating before we started. But she is the executive director of the milk bank that was founded in the Northeast of the US. And I worked with her on establishing safe workplace policies at the beginning of the pandemic. And one of the things that I learned was that there are very general principles, but workplaces very often require very customized policies that have to arise from a very direct understanding of what are the principles involved in transmission. It's not so easy to set up a simple set of guidelines and say, follow these guidelines and everything will be okay. One really has to understand the nature of specific conditions in particular workplaces. And I'm sure that people here understand that, but I wanted to point that out as one of the things that I've learned over the pandemic. At the same time, there are some very general principles, some of which have been incorrectly described and discussed. I want to take a step back, though, and talk about systems and complex systems and what we learn from systems about pandemics. And articulate a little bit about this, the methodology that I use for thinking about these problems. The fundamental approach that I use is about identifying the greatest levers for implementing change in a system. And part of the challenge of the mathematical tools that we normally use is that we talk about measures, but we don't easily have the tools to talk about measures of influence for change. So not only we have to track the change in a variable, we have to track the coupling between variables, how things depend on other things. And that understanding of dependence is actually fundamentally difficult in the traditional mathematical structures that we use. So the way I often describe what I do is to say, and maybe I should ask how much time do I have, because I can extend or shorten this story, and it would be good to know whether I can get to some of the key things that I want to say.
We actually go until 3 o'clock, so keep going. What do you think, Val?
Yeah, I would
Okay.
say, I mean, you could safely go till 10 after or quarter after. We do have Jose here, and we do want to hear
Oh yeah, I'm sure
from
Jose
him,
is.
right? And have chance for questions and dialogue. But we're also very interested. So is that fit, do you think?
Yeah, that's great. So
Great.
something like 20, 25 minutes is perfect.
Yep,
Thank you.
thanks.
So the way I often describe this is, let's say you have a car sitting in your driveway, which you may have, but you forgot how to drive it. And so you go out to this car and you say, okay, how am I going to learn what to do? And if you don't know, then there are many things that you might try, like opening the trunk and closing the trunk, or opening the doors, maybe try to rotate a wheel. But the point is that if you knew that it was the gas and the brake and the steering wheel and the shift, that's all that you really need to know in order to operate a car, that would be a tremendous help in figuring out what's going on. In fact, within very short period of time, with that information, you would be able to figure out how to drive, I think. And it's the same thing, that capability, that enables you to think about pandemics. Because if you know that the variable that you have to talk about, which everybody knows, is R, the transmission rate, whatever equivalent variable of the rate of infection, that's number one. Number two, you have to know that travel and transportation, how the disease gets from one place to another, is the second variable, right? Because if you cut the transportation links, then you can confine the disease to a particular location and it doesn't get to other places. And the third thing is a subtle parameter, a subtle variable, and that's the fact that the number of cases is discrete, that zero is different from every other number. So that if you get down to zero, you can stop it. And this goes back to understanding that pandemics are basically like fires. You put them out completely. And what you really want to do is you want to aggressively put it out. So that's why we have alarm systems. That's why we have, you call the fire department and they don't sit there until the next day, say, oh, let's wait and see what happens. Is the house going to burn more or is it not going to burn more? Right. So the whole attitude about fires is dictated by the fact that the faster you act, and if you act completely to put it out, that you can stop the damage that is going to happen. And it turns out that for pandemics, it's actually even stronger statement than that, right? Because if you look at fires, and we could talk about it, fires grow sometimes exponentially, but more or less they grow like power laws, whereas pandemics grow exponentially. And so you want to stop it as soon as possible because that's going to be the least harm, the least damage. And that harm can be measured by any measure that you choose. And this has been this confusion about the economics versus the health. There is no such trade-off, because if you actually act strongly and stop the transmission, you of course stop both the damage to health and the damage to economy. And that's been verified. Cécile Philippe from France has done amazing papers using the standard measures in order to make it clear that the areas that have strongly suppressed the outbreak have done much better. And that, of course, includes the Eastern Atlantic provinces of Canada versus the rest of Canada. So this is an important framing. What is the most important thing? Now, when we take one more step in, we realize that each of these variables has its own ways to control what's going on. So travel restrictions don't only have to be travel restrictions. They can be quarantines. You can allow people to travel if they have effective precautions. There are all kinds of ways to talk about that part of the equation. You can also talk more carefully about zero versus other numbers, because you realize that with contact tracing, you can stop small outbreaks, at least under some circumstances. But so you can have a few cases and still stop it just by having effective contact tracing. But you can't do that for 100 cases or even 20 cases typically. And then when you talk about R, you have to understand about transmission. And in the case of transmission, what we've seen is that people have not been effective in dealing with it. It's the most important thing that we need to know is how to get R significantly less than 1 so that we can reduce the transmission, so that we can stop the outbreak, so that we can have safety in locations. Living with a virus doesn't work. We've seen that over and over again. How do we do that? So one way that people have focused on is vaccination. But if you have one tool in a fight, you're in a fight, and you have a good left hook, do you keep your left hook or do you also do your right? Do you use your feet or you don't use your feet? And the answer is, what you need to do is to put together a set of things that are going to be effective. And that's true in fighting a pandemic. So what we want to do is put everything that we have, and you want to get those things right. And over time, you want to get them better and better, not kind of sit back and say, well, we did a little bit, maybe it'll be enough, let's wait and see. So the waiting and seeing is a problem. In fact, much more fundamental are two different things that we've seen rampant. One is the idea that it's not so bad. The idea that it's not so bad is fundamentally wrong. As soon as you have many people that are getting infected and many people that are dying, you better realize that this is a severe disease. And with COVID, it is a systemic disease. It is not a respiratory disease. It attacks receptors that are in the lung. And so people think of it as another respiratory disease like the flu, but it's not. It's a blood disease. It's a vascular system disease. It affects the brain. It affects the organs in general, and in particular, every organ that has the ACE2 receptor, including the intestines and so on, is being affected very badly. And the impact of that on people's lives, we're only beginning to understand. The symptoms of long COVID are affecting about 1/3 of adults who've been infected, regardless of the apparent strength of the infection. There is some correlation with strength of severity of the acute disease, so on and so on, as people call it, but it's not that strong. And of course, with children in schools, we've learned that children are also affected very strongly by long COVID, and increasingly they're affected by the Delta variant. So we have all of this about mutations and the fact that mutations are causing problems in more transmission and in more severity and in breaking through the preferred method of fighting this disease, which is the vaccination. Again, we have lots of problems, but what I wanted to get to is we all know that there's been this huge error, and Jose will talk about it next, this huge error, which has been a historical error in science and in medicine of believing in droplet transmission as the way things happen. You breathe out and everything drops down, and 6 feet later, it's just not there. Whereas really, the story is that respiratory particles are best understood as smoke, and they spread around in the space. And once you understand that, it totally changes the nature of how we deal with this disease. So the question is, how do we deal with this in the workplace? And the answer is, the first thing and the most important thing is to realize that it's possible to act. And everyone here, I'm sure, who's involved in workplace health and safety knows that there is a tremendous amount of attention over many years for ensuring workplace safety. And all of a sudden, with a new pandemic, people go and say, nothing we can do. We're not going to do this. We can't do that, or whatever it is. this can't-do attitude, this fatalism, is actually the worst thing that can happen in a pandemic. And it's not justified. And we know it's not justified. So the question is, how do we change the spirit of what we're doing? So I actually want to point to something else. I'll just say this, and everyone may be, have their own feelings about it. We've become bureaucratized. There are so many layers of the way that we say, no, we can't do something. Because that's what a bureaucracy does. It says, no, you can't do that. And there are even some good reasons for that, right? Because when we have even safety rules, the reason why we have these safety rules is because there are lots of things that you shouldn't do. You have to follow these guidelines and those guidelines and the other guidelines. And so that makes a difference. But the problem is that the rules as they're written are not what matters. It's that the society has decided that we are disenabling people to making innovation, to making change. And when we have a new disease, we have to sit together or separately, together virtually. We have to think about what it is that we can do that will combat this disease. And that means teamwork. It means bringing people together that don't talk to each other normally, whether it's aerosol scientists with physicians, with safety experts, with public health people, whatever it is. We have to bring people together to ask the question, we have this challenge, what can we do now? And if there is a big danger, then we have to be willing to change the way we do things in a fundamental way in order to ensure safety. And this is something that has been the biggest failure of the Western establishment, from my perspective. Now, what does complex system science have to say about this? And the answer actually is very clear. Let me start with what I talked about before in the essential variables. We talked about the fact that we need R to get less than 1, that we need to control travel so that the disease doesn't go from place to place. It turns out that when you think these things through, you realize that the most important thing is that the communities themselves are taking action. This is not, fighting a pandemic is not just a professional action. It is a community action. And it's obvious that that's the case, because who has to stay distant from each other? Who has to wear masks? Who has to, if you make a list of all of the things that you have to do, most of them are things that everybody has to do. And then there are a few things like providing testing, doing contact tracing, providing isolation facilities, which is really where isolation should happen, not in homes, because people are going to transmit in homes. We know that. The point is that most of the action is community action. And when I was involved, I didn't do it myself. When I was involved in the fighting of Ebola in West Africa and the Congo, this was the message that I brought. But the amazing thing was that people had figured it out themselves. In the communities in Liberia, members of the community went door to door to identify cases using forehead thermometers and then to isolate people in the communities. And that's what stopped the outbreak. They were predicting all of the big papers, if you look at them, and the CDC modeling was predicting millions of people were going to die. Burnout was what they called it. Everybody was going to get infected in West Africa. It turns out that there were 11,310 deaths in a population of, I think it's 10 million, maybe it's 20 million, something like that. And there were about twice as many cases because the fatality rate was a factor of about 50%. So why did it stop? And the answer is because the community members and the communities took ownership of the process. Fast forward to today, I can tell you that despite the terrible and horrendous trajectory of the pandemic in India, now in many parts of India, communities are taking ownership, and they're at levels of cases of 1 per 10 million with Delta. And they don't send kids to schools. They have remote learning across India. So it is possible to use this strategy of community effort. So take that into the workplace. Who has to be responsible? The most important people that have to be responsible for safety in the workplace are the people that have the responsibility for the workplace. The workers themselves and the people who are responsible for organizing those workplaces. But it's absolutely essential that they be provided with clear information. And that's where the community of people that are involved in safety in the workplace are essential. So providing clear information, providing clear guidance, and not hedging. There is no hedging. People think that just because transmission is probabilistic, that there is uncertainty about what the guidelines should be. It's really not the case. The guidelines are pretty, can be made very clear because they're guided by precaution. They're guided by an understanding of the basic physical processes, airborne transmission. And they're guided by an understanding of the dynamics of the workplace and the process of transmission from community to workplace and from workplace to community. So let me say something about where this has led me, because we just have a few minutes, but this was supposed to be the crux of my presentation. The real center of everything that we have to do is that people have to take responsibility for themselves. So I haven't spent a lot of time over the pandemic, a lot of my time working on the science. I've written papers, talking about different pieces of this, but the vast majority of the work on those papers was done by my students and postdocs. I spend most of my time working on trying to figure out how to bring to the communities around the world the most basic understanding, the most essential points, and to figure out a way to communicate to them that this is not my responsibility, that this is not the medical system responsibility, which is super important, that this is not the politicians or the government that is responsible for doing this, but it's their responsibility. And in democracies, we all know what the politicians are good at. They're good at positioning themselves where the people are. And if that feedback loop is not the best feedback loop in a pandemic. So what we have to do is we have to figure out how to create collective action at the community level in a context of unreliable leadership and confusion about the nature of what is the most important information to focus on. And all of the disinformation and misinformation, the way it's all done is like a magic trick. You point at something else that's not important. It may even be false. It may be wrong, and often it is. But the most important thing about it is that it's not the important thing. So that's where the communication happens. That's where good science happens. That's where it's important to have outstanding communicators. It's important to having good leaders where you can have good leaders. But if we don't focus on the fact that it's a community action, we will not be doing the thing that's needed. And so over time, I've tried to figure out how to do this. And the World Health Network, which has just been formed and is just learning how to act in the world, and we're doing it as fast as we can, is designed to bring together good science with good communication, to articulate good policy, to interact with key communities, primarily and firstly the community of the public, but also business, policymakers. We have to work on this together. And that's what the World Health Network is about. And I would like to welcome everyone. We have, people who think that this is going to stay the way it is now, or that this is going to be possible to tolerate into the future. Things don't work that way. The whole narrative about, it becoming endemic and mild, it would be extraordinarily unlikely for that to happen. I wouldn't mind, of course. There are lots, a year ago, a little bit less than a year ago, maybe a little bit later in the fall of last year, when the narrative started becoming clear, where everyone was saying, we'll vaccinate our way out of this pandemic, I said, that would be nice, but the plausibility of doing it is so small. And the better way to think about it is that there is a stable point that we can get to if we try. And that's the place where we no longer have this virus transmitting among people. It may take a while to get there, but even the statement that this disease will become endemic is not a strong statement, because endemic diseases that have been terrible have been present in humanity for millennia, and we've eliminated them in localities. We've eradicated them globally or close to it. So there is no narrative that really makes sense from a scientific perspective, except what's called progressive elimination. So we've devoted ourselves to figuring out how to get us there, and along the way, how to save as many lives and protect as many people as we can. Everybody who's involved in safety in the workplace understands this, but we have a huge amount of work to do. And the only way we're going to do this is together. There was one other statement that I wanted to make, and I'll just say it quickly. Teamwork. It is not possible to cope with a complex problem except for bringing multiple people together who have different capabilities and have them work together in a context of shared endeavor in order to stop this pandemic or to deal with any other complex challenge. I can show you the mathematical proof of that. It derives from Ashby's law of requisite variety, if you want to look at it. But the upshot is that if we don't get multidisciplinary teams together to confront this incredible challenge, we're surely not going to be able to be successful. We are doing our best to make that happen. I hope many of you will join in this effort. Thank you.
Thanks a lot, Yaneer. It's very inspiring, and we all, I think, would like to be able to do more. And I think several of us are part of the Aerosol Coalition in Canada, which is multidisciplinary, and it is critical to have all those different views and understand that, you know, people are energized in different ways and can carry the torch for a little while, but you need the team to keep it all going. So I wasn't sure if you wanted to mention anything about, I think you have another summit coming up, or how do people register for the network?
Yeah, we've just run up. So those of you who would like to keep informed about what's happening, first of all, we do have a summit coming up. It's, I think, the 20th and 21st of next month, or this month, I guess.
This month, yeah.
We're in October. So it's not that far away, about 3 weeks. It's also welcome for those to propose um,
Committees.
workshops. I think to have that meeting without having a workshop on workplace safety would be unfortunate. I think we should definitely have at least one.
Good idea.
And the other thing is that we have ongoing project teams that are formed out of people from around the world. Whoever would like, that you can put up a notice that you want to work on a project or join a project that's already in existence. There is an active project on air filtration and DIY air filtration, which is has been motivated by schools, but is equally applicable, of course, to many workplaces and many other kinds of many other workplaces, many other kinds of buildings, and so on. And that's going on very well. It includes Stéphane Bilodeau from Canada. Many of you, I'm sure, know he's really spearheading that effort and is doing an outstanding job. So that's one project, but it's surely not the only project that people can be involved in.
Great.
If you want to, yeah, the link was just put into the chat. There is a sign up page there. You will be, we look forward to bringing you on a tour. We have a much better virtual environment than this one, I can tell you. It's a next generation virtual environment that I think we can use for this purpose.
There's a couple questions that then we definitely need to switch over. Dorothy, I think, asked about, you didn't actually mention unions specifically, but they've played an important role in the pandemic and I think in the history of health and safety in workplaces. Where do they fit in your model, I guess is the question.
I think unions can play an important role. I think the question is whether they play an important role. It's the choice. We've seen in some places, we've seen unions that have been incredibly constructive in pushing for efforts. The National Nurses Union in the US has been really ahead of things in promoting very strong action. There are 1 million nurses, they represent 1 million bedside nurses, and it would be incredible if more unions were the same way. I will say that we have to acknowledge this, that I don't know how many of you know about regulatory capture, but regulatory capture is a situation where there's an agency of the government that is designed to regulate a certain industry, and the industry captures that agency, and therefore the regulations are no longer in the direction that they were intended. And that's happened in the U.S. since the Interstate Commerce Commission, the first major federal agency. We do have this problem with capture of agencies, there's no doubt. We also have this problem with capture of unions. There is no doubt that some are in that way, and it's hard to see when it's happened. We just had a teachers union in the U.S. holding a press conference with anti-vaxxers and denialists. This just happened yesterday. So it's very clear that unions are not always serving their members. But is it possible? Is it important that we should promote their involvement? Absolutely, yes.
Thanks. And Lawrence commented about the phrase social discipline, and that you're right about the community effort, and that it's social, I'll just call it social discipline based on the understanding of disease, and that in COVID-19 we've seen that in New Zealand and China and others that understand the transmission, top-notch leadership, and that level of social discipline or engagement, that everyone's in it together and can solve the problem, I think is.
I think, people make a big deal about this autocracy, presumed, whatever it is that they want to blame China for. China has, every country has its challenges. Every country has problems, and I'm not saying that they're the same. There are better things and worse things, places you may want to live and places you wouldn't want to live. But I do think that the biggest difference about China and other countries is that they're a young society, that they have just emerged through the industrialization process into the new post-industrial time. And because of that, they have a lot more flexibility in what they're doing. They haven't ossified, they haven't rigidified some of their processes. And so when they look at something, if you look at, there was one mistake, I guess you could call it a mistake, that I made over many years in saying things about the world. And I mentioned in some presentation that I was concerned about the fact that China was doing the design of Shanghai. They built a whole city and it was unoccupied because they had done a centrally planned process. And I made that statement. But eventually Shanghai was a big success, counter to my concerns. And I think the main thing that I would point to is that they've learned how to do projects at a much larger scale. Whether it's their train system or their other things, they're not afraid to engage with mega projects. Recently, yesterday, I guess they just, they announced it earlier, but they just launched this 5,000 bed quarantine facility, which is an impressive effort done. The construction took less than 3 months. So my guess is the design effort was not spoken about. That took somewhat time too, I'm sure. But the point is that if people sit down and say, look, how much money is being spent on infrastructure or supposed to be spent on infrastructure? $1 trillion. But what is the thinking behind what that's supposed to accomplish? How can we engage in projects that will really create safety? And let me give you an example that I've proposed. I'm taking too much time, but maybe one more. When you do security in an airport, where do you do the security? Do you do the security when you land? No. Where do you do the security? Before you leave. Why? Well, it's obvious, right? Why would you wait until someone gets to a destination before you figure out that you didn't want them to be there? So why don't we have quarantine facilities at point of origin? Now, Canada has actually done this, right? Canada has said you have to quarantine before you come to Canada. It's one of the very few places in the world that this is being done. And I know that it was done for the Northern Territories. And I know that this was also done by the country. It's not the whole quarantine process. But why don't we systematically, globally create quarantine facilities in countries, not so that people, when they arrive, quarantine, but so people before they depart, quarantine? And if I can just say this, and I apologize for taking credit for an idea, though the idea is very ancient, it's not mine. But I pointed this out also for Ebola in West Africa. The problem is that people aren't asking the question. They're not saying, we have this really big problem. How are we going to solve it? There are lots of good ideas that are not being acted upon. And what I want to do is to challenge everyone, challenge ourselves to think outside the box. I just, after this, yesterday, I was thinking about this. I said, I want to draw a picture where I have someone thinking in the box, you know, going around and around inside the box. And someone thinking, it says out of the box on top of it. And it shows someone going sort of just a bit outside the box, you know, like these, you know, geometric puzzles that you may have solved when you were a child. And then a third picture that says how I want people to think. And you see this person traversing this whole space, sometimes, very rarely, being inside the box. We need to think out, not just outside the box, but fundamentally, what is it possible for us to do in order to confront this pandemic? Thank you, and sorry to take so long from.
No, thank you. We appreciate it. But I will. Are you able to stay till 3 if there's any questions at the end, or do you have to go?
I'll stick around. But
Okay,
Jose,
thanks.
I'm sure, has also a lot to say, and thank you very much.
Yeah,